surgery in general has been something that unfortunately has been preserved for Caucasian women, and I think that we as African American women are just starting to realize the benefits of it. It seems as though before it was taboo, it was something that you'd never talk about, because if you did, people would look at you as if you were strange, like, oh, that's a Caucasian procedure.
I just think it's something that we as Black people tend to talk about, and sometimes we tend to talk about each other in a not so positive. I think it's a personal decision. I think that it should be looked upon as a personal decision and not a judgment decision to decide to have the surgery. I've been dieting all my life. I've been dieting all my life to try to lose the stomach, and I would lose in my legs, I would lose other places, but I'd never lose in my stomach and my shanks. That's just where my weight went. And I exercise, like I said, forever. So, so I thought I was doing the right things before the surgery, but the weight just wasn't coming off.
The patient schedules a consultation with the doctor where he goes over the procedure.
Now the procedures, they normally range between $5,000 and up to $15,000. The African American people and other people of color now, we are becoming more affluent, and now we have more expendable income, and we can spend that kind of money to make ourselves look good. So we are the American Academy of Cosmetic Surgery, the National Society of Cosmetic Physicians, the American Society of Plastic Surgeons, all know that the new growing market in cosmetic procedures are people of color. And I believe because the costs have gone down, and one of the best things that happen is that the procedures that's all-time safest and the technology that's all-time best. So what better time for us to get involved in these procedures than now?
The patient then signs consent forms agreeing to the procedure.
It's Monday morning and I'm on my way to have my procedure, and I am a little nervous because I don't know what my expectation. I don't know what to expect.
You're right, baby.
You're going right, Daddy.
I know it, but you got 2 lanes going.
Well, then get in either one of them. My parents are down from Dallas, Texas, and they came down to take me to the procedure and be with me afterwards. So I'll have someone to take care of me. But my expectation is that I'll sleep most of the day today.
Moments before Patrice arrived at Dr. Johnson's office, she received a phone call from his nurse.
I just found out I have to get something to eat and drink a Powerade before the surgery. I'm not really sure why. I thought they told me not to eat anything. Maybe they don't want me to be nauseous.
After a quick breakfast, Patrice arrived at Dr. Johnson's office, Rural Advanced Healthcare at Vinings, where she was greeted by his nurse.
My name is Nicole, and I'll be sitting at the head of the bed with you. So if you need anything, for me to hold your hand, rub your head, get you a drink of Gatorade, whatever you need, I'll be there for you, okay?
Okay. My blood pressure was a little high the first time, so she took it a second time and it had come down some. But we think it's because I ate bad yesterday and my nerves are bad.
After being given mild sedatives and Valium to calm the patient's nerves, Patrice falls into a quick slumber while she awaits the doctor. The patient is awakened by a knock on the door by Dr. Johnson.
Beautiful, how are you?
Good, how are you?
Yeah, I'm excellent. So are you ready for this?
Yes, I think so.
You get a little nervous?
A lot
You're
nervous.
do fine.
Okay.
Okay, but I want you to respect it. It's still a surgical procedure, but you're not going to have any pain. It's going to be a beautiful case, I already know.
I hope so.
It's going to be
That's
nice.
what I'm counting on. I wasn't really nervous about something, negative happening, me dying on the table. I was more afraid of being deformed after the surgery.
So women, I had to figure out a way that I could be not intimidating to them as their physician. And so what I decided to do was that I decided that I wanted to treat every patient as if they were a family member of mine. So it was an older lady. I looked at her and treated her as if she was my mother or grandmother. If it was someone my age, I treated her as if she was my sister. And if it was someone that was younger than me, I treated them as if they would be a daughter. And what I found out that even though, you know, especially being in academic medicine, there's a lot of new procedures that can come out there, but that kind of kept me grounded in that I would make sure that I would not do anything to my patient that I wouldn't do to my mother, my sister, or my daughter.
He then proceeds to make markings on the body to show what areas will be addressed for the liposculpting.
I'm going to be sculpture. That means that you're trying to get down to that 36, 24, 36. And not all women in those measurements, but you're trying to have that shape, that hourglass shape. So to me, the sculpturing is getting the hourglass shape.
IV antibiotics are started, and a folic catheter is also placed into the patient so that she doesn't have to get off the table during the procedure.
And you'll feel that every 15 minutes.
The patient's vitals, including heart rate and blood pressure, will be monitored continuously throughout the procedure. Dr. Johnson then starts the tumescence anesthesia process, which consists of lidocaine, epinephrine, and sodium bicarbonate.
Prior to this cosmetic surgery, I have had cosmetic surgery before. I had a breast reduction when I was in my 20s.
Patrice begins to feel some discomfort as Dr. Johnson numbs the final areas he will focus on in the procedure.
Everything is known.
I understand that plastic surgery is addicting, but I don't think for me it would be addicting because I don't like pain, first of all, and the second thing is that it could be, you know, $5,000. I could have bought a couple of Louis bags. You know, I could have gone. I love to travel. I've been wanting to go to, you know, Greece. I could have gone to Greece with that money. So I don't think for me it will become addicting.
You got all the areas we're gonna do.
After numbing the final area, Dr. Johnson takes a break and allows Patrice's mother, Mrs. Hickman, to check on her.
Something was sticking inside of me and then burning, like a bad burn.
It's hurting?
It hurt earlier.
Oh, yeah.
It's a numbing part.
Oh,
numbing is when it goes in.
Oh.
Still feel a stick, but now she's not. You're fine now, right?
I'm good.
Yeah, make sure mom knows you're good. Look in the eyeball. Make sure she's good. Look, see her smile.
Okay.
Dr. Johnson then resumes the surgery, starting liposuction. By starting making small cuts to the skin, where he inserts his micro air power tool that assists with liposuction for the collection of fat and body sculpting. During the body sculpting, the fat of the patient goes to an aspiration canister.
The fat's coming out beautifully, darling.
The fat didn't gross me out. It was just like, dang, girl, like, you know, you know what I mean? That was the thing. It was just like, I was more like did I have no self-control?
During the procedure, Patrice falls in and out of sleep.
It's a little more than just liposuction. Body sculpting means you actually sculpt the body to make it at its optimal aesthetic best. And with body sculpting, we take we pay close attention to those areas, and we make sure that the body is sculpted to perfection. And so body sculpting usually takes a lot more time. Some people call it 3D body sculpting. Some people now call it 4D. They call it high def body sculpting. Just to give you an idea, it's liposuction but custom to that particular patient.
Dr. Johnson adds his signature touch by sculpting what he calls the Johnson Triangle, which enhances the buttocks without doing a fat transfer.
You don't see us get something here with it.
That's another.
Versus this.
Once the doctor completes sculpting the body, laser lipolysis is started using the lipotherm machine. The laser is used to emulsify the remaining fat and tighten the skin. What looks to be blood pouring out of the body is actually the emulsified fat. Concluding the surgery, catheters are removed and the patient's body is sprayed so that the nurse can take pictures. Padding is placed around the patient's body to help prevent leakage of fluids onto her clothes.
After the surgery, basically what happens is that you are given a fitted garment to wear. So the first garment I got was too loose, so I had to go back and get a second garment. So I got another garment that fits me tight, because what happens is when the fat is sucked out, it's the stomach or your body tends to fill that with fluid. So what the garment does is the garment helps to suppress the body so that less fluid gets into the skin, in between the skin and the bones. So that's why you're wearing the garments.
The patient is then sent home the day of the surgery.
You wear the garment from the time of surgery at least for 6 weeks, day and night. I don't wear mine a lot at night because I just feel so compressed that it gives me a little bit of anxiety and I just feel too tight. But I have had the garment on now for 6 weeks, 5 weeks, and I will be wearing the garment because I am still swollen, and it's just different by body, but my body is still very swollen. So it looks like I will be wearing the garment at least for another 3 to 4 weeks. I don't necessarily tell people that I got surgery, but my closest friends know. Rosa knows, my parents know, you know, my closest friends know. It's truly an interest, and I think there's an interest, and I'll tell them. But I'm not wearing a sign, I didn't call everybody up and say, oh, I'm having plastic surgery next week. And mainly it's not because I'm ashamed of it, it's mostly because, like I said, it's the stigma in other people's head. People become judgmental, unfortunately.
It's definitely not a weight loss procedure. Diet and exercise are just as important, and I think body sculpting just basically helps to remove fat in areas that are very difficult with diet and exercise.
Be okay with mentally, and you need to be smart about it. If you have an eating disorder, don't just go get surgery, because it's going to come back. It may not come back in the same area, but it's going to come back somewhere. So if you're exercising and you're dieting and you're doing all the right things and you just want it to be gone quickly, I would definitely recommend having the surgery. But if you're a chronic overeater and you have other issues with food, I would not recommend the surgery. I think you need to get some other type of therapy and then maybe go into the surgery. I could just see this big stomach I had, and I just didn't like looking at it. So I wanted to get this gone, and I wanted to have a little bit of a butt. And with the surgery, you were able to see both of those things happen. But I think there are 2 more things that I want to get done, and if I can afford it and find the time, then I'll do it. I want to get my legs, and I still want to get my breasts raised. I mean, it's my life, is not affecting anyone else, and it's something that I want done. Why shouldn't I do it? If you want to go out and buy a Mercedes, you go out and buy a Mercedes if you can afford it. I'll say I'm 85% happy. I still think my stomach's a little big. So I'm waiting to see if it's really water weight, or if maybe we just didn't get enough fat out right here. So, but I am 85% happy. I can wear shirts that I had in my closet that I hadn't been able to wear. So I'm excited about it. And I just feel more comfortable with my body. At least it's not sticking out way past my breasts, My ideal size, which I want to lose 20 more pounds. If I can lose 20 more pounds, I would just be like so excited. The first thing I'm going to do is buy a bikini, because I've never been able to wear one since being an adult. And I would just like to buy a really cute bikini and go to someplace on vacation and wear it.